Hello dear students, myself Dr. Maddineni Srinivas. Welcome to my YouTube channel. So in this video or playlist, we are going to discuss and cover the previous year theory questions from MGR University, Tamil Nadu. So this is the video in which we are going to cover this August 2024 question for 5 marks, which is TINEA versicolor, which is better called as PITYRIASIS versicolor. So I am going to take the information mainly from these books, so you can read from these books after you quickly see this video, so that you are going to remember, and also it will be easy for you to revise all these questions. Very important, sometimes even 15 marks questions also came from dermatology. So this was 5 marks question. So tinea versicolor, please remember, it is also called as pityriasis versicolor. The reason for this name is, remember, wherever you hear this term pityriasis, always remember pityriasis means scaling. Okay, why it is called versicolor we will see, but you should remember the causative organism. It is here yeast, which is Malassezia furfur. Even Malassezia globosa is also one important cause. Globosa is also an important cause, and this furfur, it is also called as Pityrosporum orbicular. Basically you might have read this in your microbiology. So this is going to mainly affect the stratum corneum, and remember students, this is more prevalent in hot humid climates, and also it is more severe and persistent in the case of the immunocompromised individuals. Coming to the clinical features, so whenever you get this kind of a question for 5 marks, please try to make the headings instead of writing in the form of some paragraphs. So keep the headings, and under the headings try to put whatever relevant points are there related to that particular question, so that you are going to get more marks when compared to others who might be just writing in the form of paragraphs. So coming to the clinical features, remember students, the lesions in tinea versicolor or pityriasis versicolor are going to be hypo or hyperpigmented. So this is very crazy here. The lesions can be both hyper as well as hyperpigmentation. That is the reason why this condition is called as versicolor. Why? Because there is a variety or versatility of the colors which we can see on the skin surface. Okay. And why it is called as pityriasis? Because the lesions will be scaly. So there will be scaling present, which is referred to as furfuraceous scaling or fine brany scaling. Okay, and these are going to be in the form of small macules that can coalesce to form larger patches. And what are the common sites? Just remember, wherever the seborrheic areas, that is wherever the sebaceous glands are present in higher concentration, those sites are having more predilection for the pityriasis versicolor. So what are those sites? Upper trunk, shoulders and upper arms. Okay, face is less commonly involved, though it is a sebaceous gland rich area. Okay, so next, this is the image which where you are able to see the versatility of the color. So basically, first you should observe that these are the small macules which you are able to see, which are hypopigmented, and they can coalesce to form large patches, as you are able to see here. And on the right hand side, you are able to see there are again small macules, but here they are hyperpigmented, and these are also again coalescing to form larger patches. Okay, so this is the actual picture where you are able to see over the trunk there are so many hypopigmented macules and patches. So surface will be having scaling also, which is very characteristic of this condition. And here this is another patient where you are able to see multiple hyperpigmented. So here you are able to see hyperpigmented macules which are coalescing to form the patches. So this is yet another picture where you are able to see there are hyperpigmented patches. So this is the usual site, that is a trunk, where commonly we can see the lesions. So now coming to the symptomatology, what is the complaint which the patients are going to give is, mostly the patients will not have any symptoms. So only there will be some color change which is visible on the body, otherwise the lesions are asymptomatic. Mild itching might be present. Okay, and remember, this is slightly contagious, and even you can ask for the similar lesional history in the family members or in the context. So possibility is there that they might also be having this pityriasis versicolor. So how can we diagnose? I hope you might have read this in your microbiology. So KOH examination, that is potassium hydroxide examination. from the scraping. So we have told that this is a scaly disorder. So remove the scales, put it over the glass slide, put KOH, observe it under the microscope, and what are we going to get? We are going to get a combination of the spores and the hyphae. Spores and the hyphae, and this combination of the both hyphae and the budding yeast cells or the spores, it is going to be described as spaghetti meatball appearance. Spaghetti meatball appearance. So basically here the spores, they are compared, or they are analogous to that of the meatballs, whereas the hyphae are compared to that of the spaghetti. Spaghetti is nothing but a very costly word for the noodles. Okay, noodles. So that is the reason why this appearance of KOH in pityriasis versicolor is described as spaghetti and meatballs appearance. Very important term. And next, another investigation, or we can say bedside test, which we can do in the OPD also, is Wood's lamp examination. It is basically a handheld device, as you are able to see, small handheld device from which we are going to pass the rays, which are going to have a wavelength of approximately 365 nanometers. And basically this is going to produce different colors depending upon what condition we are using this in. So in the case of pityriasis versicolor, please remember the fluorescence which you are going to see is going to be mild, very mild yellow fluorescence due to the pteridine and pityrolactone, which are produced by the Malassezia yeast. Okay, so here this is one picture where you are able to see very mild yellow fluorescence will be seen, which is very difficult to even appreciate. Okay, so coming to the treatment part, there can be topical medication. So it is dermatology. So obviously topical, and oral or systemic medications you need to remember. So in the topical agents, just remember there is going to be clotrimazole, miconazole, terbinafine, and ketoconazole. These are the topical creams or lotions available, and there is one shampoo also, selenium sulfide shampoo. Okay, and remember oral therapy, if it is extensive, then only we are going to advise oral therapy and the oral itraconazole. Okay, doses are not very important for you. Just remember the name of the medications: itraconazole. Ketoconazole was previously asked, now it is not so much routinely used, and even fluconazole. These are the oral medications which are available for the treatment of pityriasis versicolor. Okay. So I hope you have enjoyed the video, and if so, please do hit that like button. And also, if you need this PDF of this particular video, please do comment in the comment section PDF. And my goal by the videos is to integrate and also give explanation for the theory question which were asked in various theory examinations of the MBBS profs. Okay, so and this is also going to help of the students whoever is watching for the NEET, INICET, and also FMG examination. So if you are watching from abroad doing your while you are doing your FMG, and this is going to be the next video topic from May 2024. So this is the question, the theory question. So just read it, pause the video and read it, and if you can understand what is the diagnosis, put the diagnosis in the comment section. So I will tell you what is the diagnosis. It is psoriasis. So if you wish me to make the next video on psoriasis, please do comment psoriasis in the comment section. And like I have told you, please do hit the like button if this video was helpful and you have understood this. And also go back and read from the Mantappa Manipal manual or Archit Ballur book, whatever it is, or any other book which you are following, so that you are going to remember this for a longer duration. Also share this among your MBBS groups, the profs groups, so that other students, your friends, are going to get some help from these videos. And also do remember to subscribe this video. And thank you so much for the patient listening till this point. Happy learning. Sarvam Sri Krishna from Sarve Jana Sukhino Bhavantu. Happy learning. Bye bye.